Hi guys, today we're going to be talking about hair loss. Now there are about a zillion, maybe 2 zillion different things that can cause hair loss, but I'm going to talk about it from a primary care perspective. So we can have inflammatory conditions, infectious conditions, things that are scarring, trauma, medications, problems with the hair follicle, problems with the hair shaft, but I'm going to talk about what I see on a day-to-day basis. Now, I did a video last year about telogen effluvium, which is stress related, and it's what we see when people lose a significant amount of weight or if they're on chemotherapy, etc. So, we're not talking about that one today. One of the interesting things that I see sometimes is called alopecia areata. It is an inflammatory condition of the skin, which is believed to be autoimmune, and most of the time, just a little patch falls out, and sometimes it's shaped like an exclamation point. About 50% of the time it resolves on its own in a year and the hair grows back. About 50% of the time it doesn't, and in some cases it can go on to include other parts of the body than just the scalp. But what I really want to focus on today is male pattern hair loss and female pattern hair loss. We don't use the word balding anymore because it's a little bit triggering for some people. So if I accidentally say it, I apologize. Male and female pattern hair loss, MPHL. You get the idea. Okay, so it's also called androgenetic alopecia, which means androgen is part of the cause and genetics is part of the cause. We used to think that it was only from the mother's side of the family, but there was a study some years back that showed that men who have a father with significant hair loss have a greater risk of hair loss too. So there's a lot of different genes that come into play here. I would say if you have hair loss, look at your families and see, does everybody walk around with big healthy heads of hair? If not, then there's probably a genetic component. We generally see this happen after people are in puberty, which also lends itself to the androgen trigger part of the hair loss. This is the most common type of hair loss in men, and of course causes a great deal of emotional distress. Nobody likes to lose their hair. We expect it more in men, but certainly is not welcome at any age or despite your gender. DHT in particular seems to be one of the key components in androgenetic alopecia. It is a very potent metabolite or a breakdown product of testosterone, and when it is high, we see more hair loss happen in these individuals who are more susceptible. So one of the ways that we aim treatment for it is blocking DHT. So these are medications like dutasteride or finasteride, also known as Avodart or Proscar or Propecia. And at low doses daily, sometimes these can really significantly help with hair regrowth. In women, it can be hormone androgen related, 50-50. Of course, depending on you, 100% if it happens to you. But it usually happens in women after menopause, certainly more commonly so. When you take the hormones away, then the hair loss happens. So a lot of women want to have their hormones tested. If we really want the truest evaluation of your hormones, you need to be off of them for 2 months before we do that, because if we check hormone levels while you're on them, it doesn't let us know what your body is doing on its own. There are some medications in men or women that can cause hair loss, chemotherapy being one of those, but certain anti-seizure medications, certain blood thinners. There are a lot of different ones that can potentially have hair loss as a side effect. So if you take a new medicine and notice that the hair loss happens or picks up, then that may be something to discuss with your doctor. If it's really a life or death issue, they're going to say, listen, your hair growth is not as important, but there may be an alternative for you. Sometimes people need a referral to dermatology, and they can do either scrapings or a scalp biopsy if the history and the physical exam don't lend themselves to the diagnosis. And so that may be part of what you do. So for women, as with men, we can use the DHT blockers. We can also, for anybody, use Rogaine, which is minoxidil in the topical form, but minoxidil also comes in a pill form. It was developed for blood pressure, and they just happened to notice that people on this medicine grew hair. Yay, everybody's happy. You can also use infrared light therapy. So you've probably seen those helmets and other gizmos that people wear. They actually have been shown in some studies to be useful for hair regrowth. You can also get PRP, which is where they get your own plasma and centrifuge it down so that it's platelet rich, and then re-inject it into the tissue. And for some people, that can stimulate hair growth. So there are a lot of other things out there that you can try, and I hope this is helpful in directing what treatment you seek.